Saumya, welcome to the show. Tremendous honor to have you. Could you please introduce yourself?
Hi, Aakarsh. Thank you for having me on your show. And I think it's a great platform to really have a space where we can talk
Thank you.
about authentic things and content related to mental health and psychology. So, giving an introduction, I'm Saumya Sharan, and I'm an RCI licensed clinical psychologist. And I've been in this field for more than 7 years now. I have my own private practice in Gurgaon, and I've been seeing clients of all age groups, a range of disorders, um, adjustment issues. I have also worked with schools and corporates during my career, and yes,
Mhm.
here I am to talk about some fascinating stuff.
Right. The topic we are going to talk on is narcissism. So, can we start by the definition? What it means?
Yes. So, there's a very
Mhm.
fascinating beginning to it. So narcissism is derived from a character who actually narcissist, who actually fell in love with his own reflection
Right.
in the water and drowned as a result. So that's where we get the word. But so there is a difference. We need to understand there's a difference between narcissism because that's a trait and
Mm-hmm.
narcissistic personality disorder because that's an entirely different clinical diagnosis based on certain statistical manual that we have.
Mm-hmm.
To explain what is narcissism, it's basically an inflated sense of self, a very high sense of self, your achievements, you almost exaggerate your sense of achievements, who you are, how you look, how you want to be perceived, or how you think you're perceived by
Mm-hmm.
others. It also involves lack of empathy, which leads to troubling relationships. There is a great need to be admired and validated by other people. Sometimes there are patterns, and in almost all times there are
Mm-hmm.
patterns of arrogance. You're
Mm-hmm.
perceived as arrogant. You feel entitled uh, to have all the special things in life, and you go through troubled relationships. Right. So this is basically these are narcissistic traits, and you believe that there's something special about me,
Mm-hmm.
and I need to be treated in that way. Also, one of the reasons is you can use it to your own benefit. So you can manipulate people, you can manipulate relationships to your own benefit, and it will not trouble you as much as it will trouble someone who does not have these traits, right?
Right.
But again, these are narcissistic traits. In order to have a disorder, a diagnosis, then we talk about it in a different way.
What are the criteria to determine someone has narcissistic personality disorder?
Right. So basically, we look at nine
Mm-hmm.
points out of which you need to at least have five of them, and these nine include exaggerated sense of
Mm-hmm.
achievement. You fantasize about limitless success and having limitless love in your relationship,
Mm-hmm.
brilliance. You believe that you're special and you need to have special treatment everywhere that you go. You feel entitled to have all of your needs met. There is a very strong need for admiration, continuous need, which does not go away very
Mm-hmm.
easily. You tend to take advantage of others or even exploit them to your needs for your benefit. You lack empathy, so it is very difficult or almost not possible for you to feel what it is to feel like in being someone else's shoes. And there is a sense of arrogance. So at least five out of these nine criteria.
Right.
And there are two more things. For it to be a disorder, you have to have subjective distress.
Mm-hmm.
That
What is that?
means
Right.
that there is some level of discomfort that you are experiencing in your social life or your occupational life. So it
Mm-hmm.
these traits are interfering with your functioning in your social life
Mm-hmm.
or your occupational life, right? So you are aware that this is what I've been doing, these are my traits, this is what my relationships look like. But at the same time, you're not comfortable with the way things are going because of these traits. Second is that, and third is that it needs to be pervasive. So it's not that I'm just narcissistic with you;
Mm-hmm.
it's with all people around
Right.
me, or it's yeah, right, or it's not just at home; it's also
Mm-hmm.
office, work, university, everywhere else,
Right.
right? So this is the criteria that needs to be present for. That's why you will
Mm-hmm.
not see a lot of people getting diagnosed because they feel it's working for me. I don't feel any discomfort.
Right.
So that is what is narcissistic personality disorder.
Right. Speaking of narcissistic tendencies, does everyone exhibit them?
Well, I won't say everyone, but
Mm-hmm.
yes, a lot of people can have narcissistic tendencies. When we talk about these tendencies, we also need to be, mindful or careful of what are we talking about.
Mm-hmm.
Is it that sense of, being too involved in the self or being too, because this term is very loosely used sometimes.
Mm-hmm.
Uh, being, too much self-centered or lacking empathy or arrogance, right? So for some people, yes, you could have these traits, not all of them. It's not that all of us somewhere have this. That's why we have individual differences. But yes, some people do have. But at the same time, having these traits does not mean that you have the disorder. So some people could be sort of prone to
Mm-hmm.
having narcissistic traits.
Right. Is there a correlation between narcissistic behavior and antisocial personality disorder?
In a way, yes. So I'll tell you how. All people having antisocial personality disorder will be narcissistic, but not all narcissists will have antisocial personality disorder.
Mm-hmm.
Does
Right.
does that make it clear?
So they lack empathy.
They lack empathy. Yes.
Right. Right.
But there is some chance that the narcissist can feel discomfort because of this lack of empathy. But the person with antisocial personality disorder, or who we also tend to call psychopaths,
Mm-hmm.
will not feel any discomfort because of this lack of empathy. Also, if you go deeper into a narcissistic person's,
Mm-hmm.
inner layers and personality, you will see some level of deep emptiness or insecurity, you know, almost
Right.
childlike emptiness. But with antisocial, you are probably not going to find that.
Right. How do you draw the line between self-preservation and self-obsession?
Right. Well, self-preservation is a positive thing,
Mm-hmm.
right? It is basically, you. Uh, it's a very healthy mechanism where you work on your survival. You work on preserving yourself.
Mm-hmm.
And I would say self-preservation can also be associated with self-confidence,
Right. Right.
whereas self-obsession, or being obsessed with yourself in a way that you need to go out on rooftops to talk about your achievements. A person who's practicing self-preservation or self-confidence will not feel this need to do that. For that person, it's not necessary to go out there and actually let people know about what I've achieved, and who am I, and I'm so talented and I'm so brilliant. It's all right if it is not done also. But for someone who's, I guess, when you talk about self
Mm-hmm.
obsession, there is this strong need for admiration. So they will want to be in a space where they have an audience who can actually hear their achievements out, their
Right.
brilliance out.
Does
Right?
it
So
does
that's
it
the
stem
fine line.
Right. Does it stem from a place of inadequacy to tell everyone about your achievements?
Well, yes, if you really delve deeper, if you go deeper, yes,
Mm-hmm.
there is a very strong sense of insecurity or a perceived lack which you really want to make up for
Mm-hmm.
by over exaggerating your achievement.
Right.
So, but it's a very slow process to get
Mm-hmm.
into that layer, get so deep that you really see that insecurity, that childlike emptiness in
Right.
that person.
Right. If you talk about teenagers, do they display narcissistic tendencies like when they're obsessed with themselves, or is it hormonal imbalance?
Well, it will be attributed mostly. Yes, you see teenagers who they're going through a space where you feel like they just don't care about anyone else, and not all, of course.
Mm-hmm.
Some most of them you feel like they're so into themselves.
Mm-hmm.
It's a part of the teenage and adolescence that they're going, really navigating through. It is a tough time for them. It is mostly the hormonal changes and
Mm-hmm.
so many changes in their brain that they're going through. And they're trying to figure that out.
Mm-hmm.
And I think it's so chaotic for them that sometimes they don't know how else to be.
Right. Right.
And this behavior of them comes across as this piece is so self-centered and so selfish, but it's not narcissistic. I mean, to that extent.
Mm-hmm.
Uh, for that, you need to of course fulfill certain criteria. You could have those traits as well, but if you talk about the general
Mm-hmm.
perception we have about teenagers and adolescents, they're basically trying to form their own self concept,
Right.
going through a tough time, hormonal changes, changes in the brain structure, so functions, so many things that makes them come across it as
Mm-hmm.
as nasty, self-centered. I won't even
Right.
say narcissistic.
Right. So, like, if you talk about the causes of narcissism, could one of them be unhealthy separation from the mother at early age?
Right. So, talking about the causes, there are actually you can put it into three categories.
Mm-hmm.
So, one is just like with a lot of other, mental health disorders, there has to be genetic, predisposition. It is very likely that a parent who has
Mm-hmm.
narcissistic traits could also have a child
Right.
who has narcissistic traits. So there needs to be a genetic predisposition, but not necessarily that predisposition will manifest in the form of a disorder.
Yeah.
So let's say it has to again be there have to be
Right.
environmental influences.
Right.
And so let's say I would say 80-20 or 90-10.
Mm-hmm.
Environmental is 80 or 90 and genetic is 20 or 10. But so this is there could be genetic, it's heritability. It's either that. Now there are research studies coming up where they've analyzed the brains of people with this
Mm-hmm.
disorder, and they've seen that the part of the brain to do with social skills or emotional regulation, it's different from other people who don't have the diagnosis. So another is that. Now coming to environmental factors, it's basically also children going through an environment where the parents, not
Mm-hmm.
necessarily the mother. So to answer
Mm-hmm.
your question, it's not necessarily the mother.
Mm-hmm.
It is both parents or one parent, sometimes just the mother, sometimes just the father or both. But they've gone through an environment where there was either overindulgence, so
Right.
too much
Right.
praise,
Helicopter.
too much of appreciation.
Right.
Um, well, sometimes yes,
Mm-hmm.
helicopter parenting also, but there's too much appreciation or a lot of criticism. So there's no middle ground. It's extreme, right? Or these are parents who are absent emotionally,
Mm-hmm.
or they are unavailable, or they are also abusive,
Right.
right? It's one thing that we need to understand is emotional neglect and apathy in childhood can be a ground for a lot of mental health
Hmm.
disorders later in life, right? So unavailability, absent parents, you don't have consistent parenting patterns. That means there is no consistent supervision.
Right.
So sometimes you're punished, sometimes you're not punished. So
Right.
children don't have that consistent pattern. Or
Right.
sometimes it's also, it's also, that attachment style. So children who tend to have secure attachment style will not be so prone towards this than children who have avoidant
Mm-hmm.
or anxious
Right.
attachment style.
Right.
Right? So that is there. It's basically two extremes,
Mm-hmm.
right? You're either praising the child too much or for their appearance, for their abilities, or you're criticizing too much. There is no okay, these are your strengths and these are things that could be improved.
Right.
So yes, but it's not just maternal. It's basically the environment which could be both parents, one parent, all of
Right. I read this fascinating research for people dealing with antisocial personality that they are lacking amygdala or having a very small portion of it. So, is it also true for people exhibiting narcissistic personality disorder?
yes, yes. So there is more research coming up and to be done. But if we look at the existing research, the part of their brain to do with empathy,
Mm-hmm.
it's not completely absent, but let's say there isn't. It's not developed so much. So the more empathetic you are, the more developed that part will be. So it's not developed so much. It's underdeveloped, or there is a difference, stark difference you'll find
Mm-hmm.
in that area for people with this disorder and people who don't have it.
Right. If someone wants to seek treatment for the narcissistic personality disorder or for any other psychological service, how can they contact you?
Right. So I have been practicing, as I said, out of Gurgaon, and I have my clinic in Gurgaon. So I can, I am on Practo as well. So you can either approach
Mm-hmm.
me through Practo, or I can, through this medium, I can give my contact
So,
details, and you can get in touch with me, and come and visit me for a session, and we take this forward. We form a plan. So for narcissistic as well as for other range
mhm.
of mental health
Right.
um, disorders or
Right.
discomfort.
Okay. What all psychological assessments are there to determine whether someone is suffering from the same?
What? I'm sorry, I didn't know.
What are the psychological assessments available to determine whether someone is suffering from this narcissistic disorder?
Right, assessment. So there are a lot of personality disorder, tools,
Mm-hmm.
diagnostic tools to
Mm-hmm.
understand personality disorder. These are there. There are psychodiagnostic projective techniques. So when we say projective, sometimes it's
Mm-hmm.
not very straightforward or closed-ended questions that are asked. Sometimes it's asked in a different form, and when you analyze the responses, then you see patterns. So there are psychodiagnostic tools, tests, screening assessments that are available and for which the person can be assessed for narcissistic personality disorder. But
Right.
it's also a lot about the observation that you have as a clinician,
Mm-hmm.
the history, the whole background, and during the sessions, what comes up during your interactions with the client. All of these are also a part.
Mm-hmm. Right. So, what are the forms of treatments available for someone suffering the same disorder?
Right. So that's what one of the major things here is that people will not come so often for narcissistic
Makes
personality
sense.
disorder.
Right.
Yeah,
Right.
because it's like okay, I don't care about people.
Mm-hmm.
I am not empathetic. I'm really mean to my colleagues at work or people at my office. I'm not doing well with my with my spouse, but
Mhm.
it's working for me. So if you really, tell them that, what, they will say, what, I don't think I need to visit someone for this. Things are working out fine for me. But whenever they do feel that there is something not going all right because of their,
Mhm.
traits or because of their interaction patterns, then they will sort of approach you. The treatment basically will include working on their social skills,
Right.
working on working on their level of self awareness, how aware they are of the patterns they exhibit with other people in their relationships.
Mhm.
So, so working on their self awareness. Also, now there are studies that people have, also clinicians and researchers talk about, also working on their cultivating their level of empathy, right? So the concept, a strong concept of self, right? Also working through different patterns of childhood that they've been holding
Mhm.
on to, such as the insecurities that they have
Mhm.
been holding on to,
Right.
forming a healthier concept of self. So basically, to answer your question, these are therapeutic goals that could be kept in mind when really working with someone in therapy with narcissistic personality disorder. In terms of medical management or through drugs, there is no medicine that will treat you for the
Right.
narcissistic
Okay.
personality disorder. A lot of times, there are coexisting or comorbid patterns of depression
Mhm.
or substance abuse
What about
in
OCD?
people, also OCD. So, or even sometimes, so there's OCD. Sometimes there traits of, um, a very exaggerated sense of self. So it would
Right.
also come across as bipolar, right?
Mhm.
The manic stage. So that could again be a
Right.
very, a difficult space. So all of these things can be treated. So maybe your uh, mood stabilizing
Right.
or your associated low mood can be treated. But
Mhm.
as for just narcissistic personality disorder, there isn't something that you can directly treat it for in terms of medically.
Mhm.
However, there could be more research coming up. And in therapy, these are the goals you keep in mind. And it's a slow process. Even in therapy, it's a slow process.
Right. So we talked about the goals and the medication. Any preferred form of therapy that can be applied here?
Um, I think I always feel that it's always a combination. Maybe that's
Right.
why, because I come from a space where I feel an eclectic approaches
Right.
or a combined approach is
Right.
always better. So I think, you know, working
Mhm.
on behavioral, taking up from behavioral therapy, a little bit of humanistic,
Interpersonal.
right? A little bit of interpersonal, supportive work, also a little bit of PBT. So you
Right.
take from each and you work on the goals accordingly.
Right. Right. Makes sense. So, last question would be that someone who is around someone with narcissistic tendencies, how can they support them and help them?
Right. First of all, I think it's important that to understand that as someone who's, let's say, a caretaker or who's around someone with narcissistic personality disorder, it is going to be difficult for you, right? So it's also important that they also have a space where they are taking therapy, because it's not very easy to be around people with this diagnosis. However, at the same time, what can help is being aware
Hmm.
that, this is how their communication patterns or mood patterns will look like, right? Being that awareness will help. Of course, a lot of, supporting them through um, times where they feel a strong sense of insecurity from inside. So supporting them through that. minimizing triggers around them. That is there. Also, helping them build a sense of self. So sometimes you would have to be, talking from a space of being realistic about
Mm-hmm.
someone's self concept. Finding that middle ground
Right.
between too much praise and too much criticism.
Mm-hmm.
Also having tolerance for, when they are not okay with too much with criticism at all, or
Right.
no praise at all. So being also aware that this could be one of the things that will sort of bother them or they're not
Mm-hmm.
comfortable with. So that's how you support. You're aware of it. You're taking therapy for your own emotional needs. You're supporting them in social situations. You're there to give them a more realistic picture of themselves. And also, you are empathetic. I know
Right.
it's difficult to be empathetic around a person with this sort of a diagnosis, but you try and be empathetic because when you really go deeper, you will see a very strong sense of lack or insecurity or emptiness, and it will somewhere touch you. So
Right.
yes, empathy is also important to
And they can
support
also
someone with.
model your empathetic behaviors, right? Learn empathy
Yes.
from it. Right.
Oh, absolutely. Yes. Very, very rightly said. Also, the empathy will be modeled then.
Mm-hmm.
So, and what is also important is they do well in a consistent setup where there's
Mm-hmm.
consistent emotional regulation.
Right.
So, instead of highs and lows, it's more like this. The people who are living with them are able to regulate their own emotions. It's not volatile for them. It's not being in high and low or being too triggered. You're
Mm-hmm.
also in a space where you're sort of making it stable enough.
Right.
So that is also something that could help.
Right. Thank you. You have been very insightful about the topic. Uh, I'll pause the recording.
Okay. Thank you so much.